Hello, Ben. My name is Anthony. I'm a student physical therapist assistant affiliated with Owens Community College. I'm just going to be working with you today and educating you on your stroke that you had from your aneurysm. Um, so, I can see in your chart that you had some past drug use of methamphetamines and IV drug use. And I can see you're here today because after your mitral valve replacement in your heart, I can see that you had a middle cerebral artery aneurysm, which means that you had a stroke because the artery that's in your brain got had an aneurysm and it caused it to rupture. And when that happened, your brain couldn't get the blood flow it needed, and it caused you to have this stroke, which gave you the hemiplegia in your right arm. So I'm just going to be educating you on what your stroke means for you and how you can walk with your cane around even with your weakness that you're feeling in your right leg and your right arm. I'm just going to teach you the proper way to use your cane so you're safe, and how you can get up out of a bed and out of a chair safely, which will also be teaching your guardian, your dad, a little bit how to get you up and around. So let's go ahead and get started. So you had a stroke because of your middle cerebral artery aneurysm. What that is it's when the artery that's in your brain, and the artery that gives blood to your brain and gives your brain oxygen, when it gets weakened and ruptures, and it causes the blood to not be able to flow into the brain properly. And when your brain can't get the oxygen it needs, that can cause all sorts of problems like the paralysis and weakness in your right arm, and it can cause you to have difficulty understanding speech and difficulty using your face muscles and your lips to get your speech out yourself, your pronunciation. So it's important for you to work with us today so we can get what strength you have in your right arm. We're going to try and get it back, try and get the strength that you have left. We're going to try and build it back up a little bit, the best that we can. Alright, Ben, so now I'm just going to be teaching you how to do a transfer today. I'm just going to show you how to maneuver out of a chair and then get standing and then sit back down on the edge of a bed. So for this, I want you to be wearing a gait belt. It can be around your waist, or if there's any lines or tubes or anything, you can put it around your chest instead. What this does is it makes it so when you're getting helped up, they can hold onto your gait belt, and they have something to hold on to, help you stand up by pulling on this. So that will help you from falling over. It'll keep you more stable. It'll make it more safe for you. So when you're going to be standing up, you want to get to the edge of your seat. So I want you to scoot to the edge, and the person helping you up would be in front of you, so they would be squeezing your knees together to give you more stability, and so they can pull you up out of the chair easier. So you would have your feet out in front of you, not too far apart, not too close together. You're going to be standing up with your feet like this, so you don't want them to be too close that you lose balance. I want them out about shoulder width apart. Somebody would be in front of you, and they would be helping you by squeezing your knees. And then when you go to do this, I want you to lean with your nose over your toes. I want you to lean forward. It's hard to get straight up when you stand up. So we want you to lean forward to give you some will help you get a better angle so your legs can work and get you up. So when you do this, you can use your left hand to push off of the chair if you need to. So when I would be doing this, or I would be having your guardian or your dad do this, I would be holding onto your gait belt in front of you, squeezing your knees, and I would be rocking with you until we're ready to go. So I would say on the count of 3, we're going to do some gentle rocks, and then on the count of 3, we're going to be standing up. So we go 1, 2, 3, and you can push off, and then your cane you would have right here, and you can just go ahead, you'd be having it in your left hand, like this. And when you have it in your left hand, when you go to walk, make sure you use your cane, then your right foot, and then your left foot. Your cane, and then your right foot, and then your left foot. Just like that. So when you're doing this, I'm going to have you I would be, again, right in front of you here, and we would just have you do some slight movements back till you are right next to the edge of the bed, and you can feel it on the back of your legs. And then that's how you know it's close, you're not going to miss it, you're not going to fall over, and off to the side, it's right there behind you. So when this happens, you'd count to 3, and then on 3, you would slowly lower yourself down to the bed. I don't want you to just fall backwards, plop down. So again, I would be in front of you. I'd be on your right side, off to the side right here, and I would be holding onto your gait belt. And then on the count of 3, we go 1, 2, 3, and then you would slowly lower yourself down. Try not to plop down. Try not to fall over to the side or fall backwards when you're seated. Try and contract your abs so you are more stable. That'll help give you some strength so you won't just go backwards. So when this happens, I would ask you if you're comfortable or not, if you feel like you're safe, like you're not going to fall over. If you feel a little iffy, you can get a pillow and you can put it to your side or behind you and tuck it in so you are a little bit more stable. You have something keeping you up, keeping you propped up a little bit better. That way you don't fall over. And now I'll be showing your caregiver, your dad, how to do it. So you would be having a gait belt on you, and like I said, you'd get close in to the patient. You get close in, you hold on to the gait belt, and then you pinch their knees together so their knees don't give out, so they're more stable, and you would just count to 3. 1, 2, 3, and you'd stand them up. You make sure that they help you and you help them, so it's no one is straining too hard. You work together, and then you'd make sure that his cane is going to be on his left side. So I want you to be on his right side, because when he goes to take a step with his right side, his knee could give out and he could fall over. His knee could bend. So when he's going to walk over there, you make sure you block his leg, his knee, from giving out with your leg, with your knee. So he goes to take a step, you can go like this so his knee doesn't buckle out from under him. So you just do some small steps. He can feel the back of he can feel the bed on the back of his legs. So now he's ready to sit down at the edge of the bed. When this happens, you make sure you're holding on to the gait belt still. You're still on his right side. So as he was getting over, you're on his right side, holding the gait belt. Count to 3. 1, 2, 3, and you help him down. You don't let him fall down. And again, you can get him a pillow, make sure that he doesn't fall over so he's safe. He doesn't bump into anything if he falls over. Alright, so I'm going to be teaching you one intervention to try and get some strength and coordination in this right arm. So when you're doing this exercise, I want you to try and sit up. I want you to try and not lean too far forward or too far back or to your side, and so you don't fall when you're doing it. You don't get distracted and fall. I want you to try and sit up straight, and you can contract your abs, and that will make you more stable. So when you're doing this, you're going to be lifting your shoulder. You're going to be lifting your arms up and to the opposite side, just kind of doing some reaches to the opposite side. You might not be able to get the full movement yet, but I want you to try to get some movement and try and get to the opposite side. And you're allowed to use your opposite hand. You're allowed to use your left hand if you need it, but I want you to try and get to the opposite side just like that. All I want you to do is I want you to focus on using your other arm. I want you to try and get some movement, try and get the muscles to move, try and get you to over there. If you feel like you have some sudden pain, or you feel excessively tired, like you shouldn't do anymore, like there's something wrong, then you can stop, and you can stop the exercise so you don't make it any worse than what it is. And if you feel like that happens, you can go ahead and let us know. You can call us, or you can talk to us the next time you see us. You can call me or the PT or your physician, and just tell us and let us know. You can always slow it down and try and make sure you're doing it slow and controlled. That way you aren't going too fast and you end up hurting yourself or anything. I want you to make sure you're slow and controlled. So you're going to mainly be feeling this in your shoulders because you're lifting your arm up and over, and there's going to be some gravity that's going to make it so your shoulder's going to be working to do this movement. But this should be helping you with your coordination, help you try and get movements to the opposite side, trying to get up and over. And as you progress, you can do some other movements, like instead of just out and to the side, like targeting something, like to your nose. But for now, we're just going to do some side reaches like this. And when you're doing this exercise, I want you to, again, not be leaning over to the side or forward or backward and you fall over. I want your shoulders to be over your hips. I don't want them to be out of alignment. I want them to try and be right above them. And I want your feet flat on the ground so you're stable. That will help you from falling over. When you're doing this, I want you to just do it for about 10 times. So 1, 2, 3, 4. I want you to just do it 10 times, and then you can take a little break because I know you're going to be doing it slow and controlled, so it might be a little tiring for you. And then once you've taken like a 30-second break, you can go ahead and do another set, take another break, and then another set. I want you to just do it. I just want you to do it for a total of 30 times, and I want you to split it up and just do it 10 times each set. Okay? All right, Ben. So I'm gonna have you. I'm gonna show you how you walk with your cane to make sure that you do it safely. When you go to take a step, I want you to use your cane first, and then use your right foot, and then your left foot. I don't want you to put your cane too far out to where you can't step to it. I don't want you to be stepping too far past your cane. I want you to just put your cane out and then step to it with your right foot and then your left foot. Just like that. Okay? Make sure you use it in your left hand. So I'm going to go ahead and have you sit up for me. Go ahead and stand up. Alright, so there you go, like that. When you go to take a step, I'm going to block your knee so it doesn't give out on you. Go ahead, like that. Make sure you take a good enough step here, just like that. And then one more step. So you just block his knee, block his foot so he doesn't, his knee doesn't give out on him. So when he's walking, just make sure you hold on to his gait belt. Make sure you are on his weak side. So his cane's going to be in his left hand, you're going to be on his right side. So you're on the opposite side of his cane. Thank you for your time today. Thank you for coming in and letting us teach you what your stroke means for you and how to move around safely with it so you don't get hurt again. If you have any questions, you can always ask me or the PT. You can give us a call or text us. You can always ask your physician as well. If you have any questions or concerns, don't be afraid to ask. We'll always do our best to try and help. Thank you for your time.